Hello, everyone. Good evening. Thank you for joining our April 2026 webinar with Dr. Castillo. Uh, pronouncing correctly, right, Candida?
That's totally fine, Castillo. It's totally fine. It's
Okay.
like a
Thank
family
you.
here, so it's
Uh-huh.
all fine.
Thank you. Thank you. So, before we start with our session, our next meeting will be in May. That will be in person, and that is at It's My Health with Jennifer. The next one will be the webinar 2026 with yoga practitioner and also a speaker, Vedanta, and we will explore much more about yoga. We will be celebrating International Day of Yoga um, in June, and there are not many things to announce, just like these two webinars and in-person meeting. So welcome everyone. My name is Vandana and I'm your host tonight, and we have Dr. Candida with us, who will be presenting about holistic dentistry. A little bit about her. Dr. Castillo is a Boston University trained biological dentist with over 25 years of experience and has been recognized as Rhode Island's top dentist by RI Monthly magazine for 7 consecutive years. Yay! And she is deeply committed to the mouth and body connection with its role in whole body health. With advanced fellowships, a CAGS postmaster certification, and training in biological dentistry and smart mercury removal, she continues to refine her expertise through ongoing education and institutions such as Dawson Academy, Ozone Therapy Group, and Spear Education. Her integrative approach blends modern dentistry with holistic principles, offering mercury safe removal, biocompatible restorations, extractions, cosmetic dentistry, and second opinion consultations, each designed to support long term health and overall health being. So, welcome, Candida, and the stage is all yours.
So thank you. It is great to be here. So thank you for RIHHA for having me. I'm going to share my screen.
Mhm.
We are. Can you see my screen there? Can you see my screen?
Yep, I can see it.
I can see it now. Yes, I can see
Yes.
it.
Right. So I cannot see it. Let's see if I can do this. Um, Vandana, how can I don't see I usually see it, but
You
I
want
don't
to
see
see
what you're
your own
seeing.
screen?
Yeah. Like I
Hmm.
don't see what you see, so I will not know where I
Let
am. Just
me maybe if I because usually let me make you co-host, confirm and see like, and if you can see the um, window, right, where everybody is seen, maybe one screen
Yeah,
is, yeah, one screen is just your screen,
correct.
right? Yeah, maybe just
Yes.
click on that.
Okay. I see myself, but I don't see my presentation, and I should be sharing.
Hmm.
Okay, let's try this again. Hmm.
He hates this stuff when there's technical difficulties.
You're not live, right?
No.
How about now? Can you see the presentation?
Yep.
You do?
Mm-hmm.
Um, okay, so I'm gonna go blind because I cannot see it, and for some
Just
reason, I
minimize this window, your window, the presentation window, and see, because once you put it in like presentation mode, sometimes, like, it happens. For me, it happens. Yep.
Okay, so what do you see right now? What does it
Half
show
screen, your half screen.
on that? I'm
Can
sorry.
can you
I log
see?
in early to check on this, and for some reason,
Candida, do you mind sharing all these notes to me?
yeah, of
Okay,
course. Let me do this. My apologies.
that's okay.
I did this early to
Just
check.
just send it to the Gmail, Riha9999.
All right. So let me do this because I think that's what it
Because
is. I
usually
have
this doesn't happen. Yeah. So
no, I don't know
let
why.
me stop the recording for now.
Okay, yes, please. Okay, well, thank you everybody for being here. Sorry for the late start. Um, Thank you for RIHHA for having me. I feel that this is a great space to share information for the holistic healing, to share information to grow, and to share information where you feel free to learn. So thank you. So I'm going to start the presentation with a question. What if your mouth is not separated from the rest of your body? And this question is going to come back because I'm going to be coming back to this question so we can connect it. So a little bit about myself. But Dana, thank you so much for that introduction. That was very highlighting and humbling to me. I started my biological dentistry in a homely church in Rhode Island, where I used to volunteer, and my mentor was the only holistic dentist in Rhode Island. And she introduced me to a way of looking at healing differently. I didn't know that how much connection the mouth had with the body. And since then, my life, my work, the way I do everything is pretty much holistic because I believe on that. So let's talk a little bit about coming from not being biological to being a biological dentist for the past probably 16 years. This is the difference between traditional approach and biological approach. So the traditional approach is pretty much focused on treating the tooth, repair damage, and restore function, follow standard clinical guidelines. From biological approach, we still treat the tooth, but we treat the whole person. We consider the impact that our work, our material have in the immune system and in the body. And we use biocompatibility health conscious material. So we are aware of anything that we do can cause a disruption in your body. We advance in our education more than what is required in the regular traditional general dentist, I would say. And one thing to know is that it is the same standard. We all sworn that we'll do our best, that we be honest, that we do everything that a regular dentist. But our philosophy, our approach is different because we look at as a person that is coming with a toothache, but where is that toothache is coming from? So in the past decade, research has shifted how we understand the mouth. And there's a lot of reason for this. Why is becoming more almost like a fashion now? Very fashionable. I'm going to a holistic dentist, or I'm very holistic, or I'm very biological. Well, research have actually shown that about 500 to 700 microorganisms are living in our oral mouth. So it is called a microbiome that is very complex. And the reason for that is that at any given point, we can have from 500 to 700 different bacteria in our mouth. And you might say, well, I brush my teeth 3-4 times a day. That's great. But how about if you're not healthy? if you're sick, that repopulation of the bacteria a little after you brush is come right back. So even if you're healthy, even if you sick, this number of bacteria has been shown in many research that they repopulate. So with that number in mind, then we can look at the mouth and think of where are these bacteria go? And we see that these type of species of bacteria are found in Alzheimer's. They are found in cardiovascular disease, cystic fibrosis, different type of cancer, in periodontal disease, in cavities, diabetes, pancreas, and rheumatoid arthritis. And we can say that we all know people that have these diseases. And one thing to keep in mind is that these are correlation, they're not causation, which means they correlate to these diseases because these bacteria they are found through tests in different type of diseases. So it's not to say that if you have periodontal disease, which is a lot of bacteria, this is one of the most common infection in the mouth, does not necessarily say, oh, you're going to get cancer. It's just going to alter your immune system. It's going to alter how you're healing because now you have a lot of energy that is required to calm the body. So a little bit more on that in a minute. One of the things to highlight is that there have always been a gap between the medical community and the dental community. And through research like this in the past, I would say 10 years, that gap, it's coming a little bit more closer. There's a lot more communication between the dentist and the cardiologist. There's a lot more communication about the dentist and the any type of surgery like hip surgery, knee surgery. So orthopedic in dentist, this is something that we get in the office commonly. We want a medical clearance, a dental clearance letter for the patient before they get the surgery, because they are recognizing that this is important. After a surgery that is, 10, 12 hours, and you don't take care of what could be a possible risk. So there is a lot of hope that it's not going to be only for specific cases like surgery or any cardiac condition. We want this to be more like an everyday thing that you go to the dentist and the dentist involve what's going on in your mouth to your body. So I'm coming back to this question that we started with. And what if the mouth is not separated from the rest of the body? And as we just saw, the oral ecosystem that we have, from 500 to 700 bacteria that live in our mouth at any time, going to different organs, it tells us it is connected. It is connected to a lot more than what we are being told when we go to our regular physical and say, oh, you're fine. Well, do you even look at my mouth? When you go to, when we go to our traditional dentist, and did he ask you about, your oral health? Did he ask you about all the diseases that are linked to that problem, to that disease, to that complaint? So those are things that are becoming more, I think it's becoming more popular because there's a lot more demand. There's a lot of more of us that want to live longer, and we want to live healthier. And the way to do it is by taking care of our body. So here comes another question. What if your chronic symptoms started in your mouth? So knowing what we know already that I presented with the research, now let's take a look at our mouth. Where are our teeth located, and to what organ do they connect to? And what we have is that when our oral microbiome is balanced, we promote health. when we have the good number of bacteria in our mouth that is level with the bad bacteria, because we need both, and that's important to know. And later on, I'm going to be talking about things that we do that disrupt this type of balance, not necessarily diseases, but habits that we do. So we see here that every tooth is connected to an organ. It talks, and this is a meridian through meridian connection. And when the oral microbiome it's not balanced, it's disrupted, what we create is disease. We create opportunistic, chance for bacteria to go to different organ and cause problem. So one of the things that is very common is that we have patients to come to the office and they say, I have a toothache. And sure enough, what we do, we check. And a lot of time it's not even a toothache, it's sinus, and it's so much bacteria in the sinuses that it mimic a toothache. I have a recent visit last week of a patient that came to the office, and she came with a toothache on a lower tooth. And the question was, she didn't have a problem before. We took an x-ray, and there was no sign of cavity. There was no sign of she had a filling done on this tooth. So it was literally like a virgin tooth. There was no sign of fracture on the tooth. There was no sign of any type of history or impact or any accident. But there was a sign of an infection. So when I saw this, that there was no sign of any cavity, I questioned her and I said, what's going on? What has been happening in the past, 2 years? Any health changes, anything different? And she said, well, not much, but the only thing is that I had a hysterectomy last year. And sure enough, we went to the chart, which I often do. I went to the chart and I said, what tooth is, correlated to the ovaries, to the reproduction system? And it was tooth number 24, which was linked to the tooth. And the question comes, is that always the case that you have an infection on a tooth? It will affect the organ? No. And I want to be clear on that. But you want to see the correlation. I usually tell the patient what comes first, the chicken or the egg? Because sometimes you have the toothache, but the tooth is not the problem. Like her case, for what we saw, that there was no sign of any specific problem with the tooth. It probably was the problem with her ovaries and ended up affecting the tooth. Is that 100%, happen in every case? No, but it happened often enough that we know there is a correlation, there is a communication. The meridians on our body, they connect. We have a lot of patients that come and they have symptoms with root canal teeth and problem that they have in their system. And a lot of time that nobody points out that the body is overwhelmed with the amount of infection in their mouth, and that is a linking the other symptoms is affecting, stressing the body. So I'm coming back to the same question. What if your chronic symptoms started in your mouth? So this is not something that is as frequent. We have a case that the patient came to the office and she said that she went to a couple of the dentists. And I'm not saying this because I saw the patient. This happened, you go to most biological dentists, and because we want to look more than beyond the tooth, this is exactly a routine thing. You go and you check the chart and you figure out, what is connecting. But a patient would come and she said, I just have my physical done. I just have my blood work done. But they didn't ask me, they didn't check my mouth. They didn't check my teeth. And I'm like, oh, why isn't this not happening? Because we need to educate more the medical system about, the health. And this is not a one office. This is more how our general healthcare system works. So we need a lot more education. So now that we know pretty much that there's some factors for our mouth, from dental, that affect the system, now that we know pretty much that what happens in the mouth, it doesn't stay in the mouth, it's traveled to different organ. Let's talk about what are the factors that can block healing. And I'm going to divide that in two groups. The first one is going to be hidden infections. And the first thing that I'm going to mention is cavitation, which is jaw bone infection. And this is a little bit of controversy. I'm going to talk a little bit more about that in a little bit. The second thing is infected root canals, which is also a little bit of controversy, but we're learning more about why root canal fail and how the problem arises. And the next thing is periodontal disease, which is one of the most common infections that we see in dental practices. These act as a constant immune stressors, making it harder for the body to fight. So as we saw earlier, I mentioned that the less balanced our oral microbiome is, the harder the body have to fight to be healthy, because it requires a lot of energy. Now let's take a look at how we kind of look at the teeth. When a tooth is looked at, you know that the diet is important, the hygiene. We look at in what kind of organs it is connected to. And then we kind of map how is it a tooth problem or an organ problem. And then once we have the x-ray, then we start asking questions. And I'm going to highlight one of my mentors, Dr. Owen, Dr. Dawn. She came out with an amazing analogy that I use in my practice every day to explain how the system works. And she says that our system work like when we're in the highway. So when we're in the highway and it's a traffic jam, you can get to your destination maybe 3 hours later. Maybe you can get there with stressful, especially if you have an appointment, or you can get there by cutting through other cars and taking out a different exit. But you can get there. And this is exactly how our body works. We heal, and obviously we have to provide the right environment for that healing to happen. But along the way, along that journey of healing, we can get in a traffic jam. The healing pattern, that energy that heals us, have to go through a lot of zigzag in order to heal us. And that takes a lot of energy. So if the immune system is overwhelmed with a lot of toxin, with a lot of inflammation, with a lot of infection, it will take a while. And the other side, we have the other side of the highway that shows that it's free. You take that 95 and you get to Warwick in 5 minutes because there's no traffic jam. This is exactly what happened to us when we are balanced, when we're healthy. The system works effectively. You heal faster. Things don't linger for longer. So a great book from Dr. Dawn that talks about things that happen in the mouth and explain in simple words things that kind of we don't kind of hear every day and not much people talk about it. Okay, so here's a illustration about root canal, an infection, and how we look at this type of burden on the body. So when you have, let's talk about an infection, which is what we have right here. So this shows an infection of a tooth that very likely infected with periodontal disease. Now we're going to lose this tooth. This tooth got infected, and the tooth is not the only problem. We have a tooth that is infected, and all the bone around it is infected. So when we have a tooth that is extracted and is not clean, when I take this tooth out and I don't clean none of this pinkish color or red, maroon color, that is leaving infection behind. And this creates what is called cavitation. So cavitation is one of those terminology that is in almost transition. The more that we know about a certain problem, the more that we understand it, then the variation or more specific terminology comes. So this is something that now is called CRS, which is pretty much bacteria that is encapsulated. So when you leave this problem in a jawbone, the type of bacteria that is there, that 500, 700 bacteria that we talked about that is bathing all our teeth, our tongue, our cheeks, they're going to also invade this area. And the same blood that circulates through this infection is the same blood that circulates through my heart, to my lungs, to my kidneys, to my gut. So when we see things like this, you always question how clean can we clean it? And there are ways to know how much you need to clean to make sure that you're not leaving any pathogen behind, any microorganism behind, because that bacteria will not stay there. And we have cases of people that come and they go from doctors to doctors, nobody finds anything. They have tests done, all type of tests, and nobody kind of pinpoint to what it is. And sometimes they start working with naturopath, and then they start asking for dental records. They start asking for a CVCT, which is this type of X-ray that highlights area that you cannot see in traditional X-ray. And then you can start seeing a lot clearer where if this is infected, where is this infection going? And I have a lot of testimonial of people that have come to the practice, and they have complained, they have symptoms, they are debilitating. These people sometimes they have gone through so many visits in so many places, and unfortunately, some of these people they've been told it's all in your head, which what patient is, someone tells you this, it's very it's tough to hear that you're looking for help and all you get is that now you need some type of anxiety medication to control the anxiety because no one can find what you have. And I'm going to come back and say, this doesn't happen to everybody. When you are sick, depending on the environment that you are creating to heal, your body is going to react to heal. Our body is designed to heal, but we have to provide that environment of healing. Otherwise, we can do what we usually do. Oh, I don't feel it anymore. It doesn't hurt that much anymore. We're just getting used to it, and we don't kind of listen to when the body is knocking. So the other thing to mention while I'm here is that root canal. Very similar to this infected tooth, when a root canal fails, there are options. When a patient comes to the office, you always want to give the optional, which is retrieve your root canal or extract it, take the tooth out. And for a person that is not prepared to let go a tooth, which nobody usually is, these are hard kind of, options. Taking a tooth out is taking an organ out. And for some people that are not dental aware, as others, it's a very tough decision, and that decision that you have to live with. Because if you have a root canal and you are a sick person, this is only adding more burden to your system. The other thing is also if the tooth need to come out, you need to do it the right way so you can clean the system. So the good thing is always to go back and think of options. We all have options. There's a lot of information. It's a lot of information that is accessible. And people are willing to help. There's, tons of information. I don't think Google is the best person to ask when you have medical questions. There are a lot of groups that provide information that they're valid information. So be cautious when you get your information. Know that they are sources that are not created to be informative with the potential to create healing, but more to sell information. So be cautious when you get your information. So knowing what we know now and looking at different joints, organ, different part of our body that our teeth are connected to, then this is when we stop and we say, collecting our information and connecting that information to rule out possible problems that are not usually common is important. That's when you start collecting, information in a 3D X-ray, when you start connecting what organs are not functioning, when you start connecting where the infection is, and you compile this information, and you work with other physicians, you collaborate with other people to help you. Healing is possible and it's less stressful. One of the things that it's common mention when patient come to the office is like it is expensive to be healthy, and it is expensive because our system is not a system that is designed to heal. It's designed to, in a way, very sad that I'm saying this, but it's designed to keep you sick. Our preventive protocols are mostly not covered by some dental insurances. Preventive routine that just touch the surfaces are covered, but dive deeper into getting answer are usually not recognized valuable through the some medical and dental health insurance or coverage. So it is important to always go back and say, this is not always common, but it could be common for you. And we are unique in our way that our body behaves because there's so many factors that affect how our healing happen, how long you're going to be in bed, how long, you're going to recoup. So all those things is important to understand. The other part of factors that block healing is toxic burden. And obviously, I'm concentrating in dental because this is what I know best. There are the other type of burden in our body that also act just like dental burden. So one of the things that we're going to highlight tonight is mercury fillings, metals in incompatible materials, which means that when you have a filling and after you get a filling, you have a problem. And that problem could be a simple sensitivity. That problem can be something is different. You sensing that that tooth is not hurting, but it feels different. And again, biocompatibility is important because there are some people that their system can be disrupted by one single filling. Meanwhile, you have other people that have 10 and they're okay. And again, it shows how we are all different. The other things that we're going to talk about is fluoride. And we all know that fluoride is a neurotoxin. There's no need for fluoride. We were sold into the fluoride belief many, many years ago, and it just stayed that way. And at this point, we have so many ways to avoid dental cavities that having fluoride is it's not necessary. Okay, so why are mercury filling a problem? So I mentioned about mercury being a neurotoxin. 50% of the mercury of the amalgam fillings is composed of mercury. And that's a lot. 50% of a small filling in your mouth have the biggest, percentage of a neurotoxin. And the question is, if it's no, if it's broken, don't fix it kind of thing, what we usually say. With mercury, it's a little different. The life of a filling could be 5, 6, 7, 10 years. And I have done filling 15 years ago, and the filling's fine because it depends on the environment. But the life of a filling varies depending on the patient. Clenching, grinding, habits, hygiene. So all those things are important to the longevity of the filling. Now, if we go back to why mercury filling a problem, is because of the type of toxin that they provide. They promote inflammation, and most of the diseases have 1, 2, or 3, or 4 components of inflammation. So one of the association that have provided an amazing resource in sort of information for patient, also for providers, is the IONT, the International Academy of Oral Medicine and Toxicology. And they came out with open research. They came out with a different ways to prevent mercury to continue to be a filling. They are creating a lot of advocating in different ways to stop mercury, to create awareness, not only on the public, but also on the health department. And I have to say that there is a lot of politics that arises when something like this that has a lot of investors into this type of product, it's not going to be easy to kind of take out of the market. So there's a lot of, when you see how toxic mercury is, and to know that it is still being used, maybe as we speak, someone is in a chair having mercury filling place, it's very sad. And unfortunately, the people that get this type of feeling of restoration of feelings are the people that are ignorant about the type of material that is being used. Just to create a little bit of how toxic mercury is, us as a dentist, every dental practice have to have what is called a filter, like a canister, that every single procedure that we do, that water that we use, is filtered to this filter, and anything like mercury, it's collected. This canister have to be sent to a biohazard company. It had to be maintained, which I think is amazing because we don't need more toxin in our landfills. But as a regulation, we had to keep up with that filter. The other thing is that if I want to mail out mercury to you, the post office was not delivered because it's a neurotoxin. If the thermometer, all those thermometers that we used to have that were to break, that spill needs a specific type of spill kit to clean it. Or if it's a thermometer like in a hospital, something like that, if they can clean it, the Department of Health had to show up and clean it. So all these things kind of puzzle me because we take all this caution about mercury, but it's okay to put in people's mouth. And it just some things we need to be educated. We need to advocate for our health, because sometimes the information that are given is now what we need to make an informed decision. So anything, I usually get a little passionate about talking about this because I haven't done mercury filling ever since I owned this practice in Rhode Island. I used to work in a homeless shelter. Even then, you did your best to do the best filling with the little less that you have to do it, just because ethically, we knew it wasn't right. I have a testimonial of a patient that came to the practice. This is about maybe 12 years ago. Young guy, healthy, handsome, Chris, nice guy. He came to the office because we were doing mercury-safe removal. And he mentioned that he can trace his steps onto, from the time that he got the mercury in his mouth and alopecia. And obviously, that's not one of the most common side effect of mercury or mercury toxicity or exposure. So obviously there's liability and you always have to sign something. And I said, Chris, I don't know, but it could be that you're reacting that way. In any case, the safe protocol was done for him. And a couple of months later, he did the mercury safe removal, which in a minute I will be talking about that. He did detox. And a few months later, Chris came back to the office and the balding spot, they're gone. And he's still a patient of the practice. And, it's one of those cases that sometimes it's not a common side effect, but it's a side effect. So sometimes it doesn't look like it is, but it could be. So anything that we could do to avoid toxicity is important. In YouTube, there is this video that when you have a free time, maybe you want to look into it and listen. It's called Smoking Teeth Equal Poison Gas. And it shows how mercury is released when we rub on the filling, like when we eat something cold, hot, chewy, things like that. You're releasing some sort of mercury into your mouth. And it's worse when the margin of this filling is rough, corroded, because you have a lot more exposure to it. So something to inform ourselves about it. Okay, so this is the SMART protocol. And this is a SMART protocol that was developed by the IAONT. This is the same association that provide information to the public based on research. And the kind of information that they provide is to protect the public, but also to protect ourselves. And as a dentist, you can only imagine someone doing mercury and kind of getting all that vapor. If you one person is yourself, but you doing as a provider, that is a lot of exposure to mercury. And this, when you look at the longevity of dentists working, there's a lot of concern into what is the mercury it's a state kind of creating, what exactly to what level. And there's a lot of research going through 50, 60, 40, 30 years. So there's a lot more that in the next few years is going to come to the surface, because this is something that the public needs to be informed. This is a little information from the IONT. It said removal of mercury fillings without protection can be more harmful than leaving the filling in place. And this is true because when you remove the mercury, that chemical that is done when you do the filling, it's all compacted together. But when you are removing it, you're creating a lot of gas, you're creating a lot of vapor that and you create a lot of pieces. So this specific protocol prevents you from swallowing the pieces by isolating the tooth with this Robidoux. Then you also protect you from not breathing it by providing oxygen. So under this mask here, under this Robidoux, there is a mask that is providing oxygen to go through so you don't breathe it. So you kind of create a seal. And then you protect the eyes, and you can see here that you can actually don't see a person underneath of that. But to some, this could be maybe a stream, but someone that is sick that come to the office and they can barely walk, they're completely, in toxicity with mercury. This is very important because you don't want to bring any of that home. You want to leave whatever was removed, you want to remove it safe and not bring it to your family. Okay, so now what? We talked about different things, how do the mouth connect to the body. We talked about research and how good information we're getting about creating awareness. We talk about a little bit about how to protect us from some of those toxic material. Now, what do we do? Well, the thing that we have to do is that we have to focus on the root cause. Find out what's the problem. And sometimes that can be very challenging because you don't have the way to, but find information. There are a lot of resources that have legit based, research-based information that you can use. Do you want to focus on the root cause? You want to clean any inflammation. Those are the two things that overwhelm the body and avoid healing. You want to minimize toxin. We just talked about mercury. We talked about root canals. We talked about infection in the mouth, like periodontal disease, that it has a almost direct impact with cardiovascular problem. And there's tons of research on that. You want to support natural healing. And how do we do that? Well, there's different ways. I'm sure sitting on this Zoom call with different providers that they work naturally. There's so many ways to create energy that promote healing. We have in the office ozone, that is a gas. You use medical grade gas to convert this gas for healing, and you use it for numerous type of procedures, prevention. You can use laser. Again, it's heat. You're creating light with heat to promote healing. No chemicals on that. You can use your own blood to create healing by using your own plasma, fibrin, to empower the body to heal itself. So there's a lot of ways to be able to create healing without drugs, medication, things that are helping you here, but creating a problem on supporting you healing in other ways. So here are a couple of things that I brought to present, because these are some of the things that are more asked by practitioners like functional medicine, naturopath. They always ask for things that help and heal the patient without medication. One of the things that they ask is the 3D X-ray, which is a cone beam. And right now we have low radiation. The technology is so advanced now that people used to be very concerned about the radiation. Well, now the radiation is very low. So these are things that usually are on request for any naturopath, because they want to know that they are creating a healing from within. The other things that we can do is support our oral microbiome. What can you do to create that balance? Are we good with our hygiene? Are we good with our supplements? Are we good with our regular visits? Are we good making sure that our periodontal disease is controlled? Avoiding toxic procedure, like having any type of procedure that will have side effect. like any type of, I have biocompatibility here. And if you were to test the material, well, you can create a healing faster because we know we're not going to be overwhelming the body with any type of procedure that has material that now is not compatible. We talked about safe removal, obviously protect yourself. Use alternative options, just like what I mentioned, ozone, PRF. We have laser. The other things that is important to mention is breathing through your nose. We have a wave now of awareness of apnea, snoring, things like that that create a lot of overwhelming in the body. If you're not breathing well, you're not resting throughout the night, you're waking up tired, that means you're not healing. If you don't heal, your mitochondria is not repairing, your cells are dying. So it is important to check these things because they come together to provide a better healing. Choose hydroxyapatite-based toothpaste. This is a common question that we have in the office. What kind of toothpaste do you use? And the first thing that I usually say is that anything with fluoride would help. Hydroxyapatite obviously provide the benefit of remineralizing the surface, the enamel. Ideally, you want a toothpaste that will complement whichever the problem that you have. If you have a lot of cavities and you want the hydroxyapatite, you want bentonite clay, you want toothpaste that promote probiotic. So there is option. Fluoride is not needed. Use non-alcoholic, that sounds a little bit, non-alcohol based rinse of any oral type of material. And this is very common that people come to the office and they have rinse like Listerine, that the content of alcohol is very high. So what you're doing is that you are killing the bad bacteria, but you're also killing the good bacteria. So you are disrupting this balance that we're looking for. Microbiome-friendly rinses is something that you can make at home. You can make it with essential oil. You can make it with salt, any Celtic salt or Himalayan salt. It's simple. I remember when I was a kid, they always said, rinse your mouth with, salt water. It's something that we have at home and it's to our disposal. So we could use that. We can make a rinse with hydrogen peroxide and water. You can mix it 50-50, and that is non-toxic, and it doesn't kill, the good bacteria. Maintain consistent brushing and flossing routine. Stay hydrated to support saliva and detoxification. But not a lot of people talk about how important it is to drink, to be hydrated. It is important if you want to detox, you need to hydrate. That's the only way for you to kind of get rid of toxin that is just laying in and staying in different area. Exercising, obviously, not only for the teeth, but for the whole body. So everything is connected. So maintain regular biological dental checkups. Obviously, we care to look not only at your tooth, we're going to be looking at a lot of other areas. Okay, so healing. So to me, healing is balance, and I'm finishing up at saying that we all about balance. Everything in our body is need to be in balance. When you come and you have problem, that healing is not going to happen just because you're taking care of the tooth alone. Is not only because you have that infection taken away. It's not only because you have, it's not that only, it's a combination of physical balance, psychological awareness, emotional health, and a spiritual connection. We all have to be connected to what brings peace to our whatever you call your soul, your karma. You need to be balanced to create that healing. We have so many modalities. We have so many good things to create healing. But if you're stressed, overwhelmed, and psychological, spiritually, emotional, and not in a good health, we're only putting a patch, and the healing will not be 100%, or at least it will be delayed. And that's all I have. I sent a lot of information. I hope you have some great questions, and I hope this information is valuable to you all. Thank you.
Thank you, Candida. That was like wonderful. We have a few questions.
Yes.
I have a question.
Yes.
So the people that have cavitation infections, do they have any pain in their mouth?
Good question. There's not always a pain. Most of the time, there's no pain. There is other signs that show that there is something, there's something that is off. A lot of time there are some people that come with symptoms, but most of the time, 90% of the time, there's no symptoms. Sometimes by coincidence, you look in a CBCT and you'll find it, or you send the CBCT to be read, and it comes back, and the radiologist would say, yeah, there is a sign there that there is a bone that is the consistency is low, which means never heal. It's healing. And if something was done 2 or 3 years ago, it shouldn't be healing. It should be healed by now. So that's how we know. But a lot of times what we see is that the cavitation is clean, and people that have chronic symptoms, it cleaned up, disappeared, and people start being more clear in their head, more energetic. So it depends on how much burden, how much overwhelming this specific cavitation is causing in your system.
Okay. Now, how about a root canal teeth? Is there any way that, I know you have an x-ray that you look at the whole mouth, and I've had that done myself. Can you always tell if the root canal tooth is a problem? How can you keep up with knowing, like if you have root canal teeth in your mouth, how can you keep up with making sure everything is okay?
That's a great question. So usually what you do is if you have, because you need a baseline. If you have no symptoms, and let's say you are concerned about that particular tooth, and a CBCT was taken, and the CBCT, the X-ray, the 3D X-ray comes back, and it says that that tooth is fine. There's no problem. Then what you do is monitor. Always check for any signs of that tooth changing. The radiology, like the picture of it, make sure that it's not changing. Any sign, sometimes people will come and say, ever since the root canal was done, it feels like I feel that tooth. I don't feel the rest of my teeth, but I feel that tooth. Well, that's a sign. Something is, that tooth is knocking somehow, and it's giving you symptoms. And I want to go back, because that's a great question. I want to go back and mention that everybody is different. There's some people who have root canal and they healthy. They don't have any symptoms. They have no sign. The body fights it in a way that there's not a problem. Root canals has been done for many, many years. Now this is what is coming, to the surface, that there is no root canal that is supposed to be free of bacteria. So we're getting a lot of more information, but the body is just so amazing that you need to collect the information and put it together, because not everybody what comes to the door wants to get a tooth out. So when you have a question like this, you have to target to, the individual tooth, and what is that tooth presenting as a symptom or not. So having a CBCT like your case, what you do is a couple of years later, we can always compare, have anything changed. And that would be a more reliable form to compare, because it's a way to turn that tooth 360 that you cannot do that with traditional x-rays.
Yeah.
Does that make sense?
Yeah, it does make sense. I have one more question. Have you ever found any mold in anybody's mouth? Mold, like from a root canal tooth?
Good question. So what happens is as follows. When you do a root canal, the root canal pus consistency after the tooth is extracted and part of the tooth is sent to for biopsy. And then that comes back and you have a number of bacteria. And this bacteria can, go from being really yellow, which is okay, to being very red, which is very toxic. So it depends. It depends on what comes out from that particular tooth. But once it's sent out, you can actually see a specific for that site. And what is interesting, now that you asked that question, is that there has been cases of patients that had a root canal on the right side and on the left side, right and left. And they would do a biopsy on the right side root canal, and the the microbes, the bacteria that came from the right side, it's different than the left side. That tells you that it's, the body is so amazing. And that is because of our healing capacity. We always try to heal. The body is in a constant healing state. So, but the only way to find that is by sending it to the lab for biopsy.
Mm-hmm. Okay. Thank you.
Thank you. Great questions.
There are a few more questions in the chat. I will take one by one. So,
Thank you.
Zoom user Anna, she's asking like, why are some pediatricians still using mercury, saying it's good because it's very temporary and won't cause any harm?
What was the first part of that, Vandana, please?
The pediatricians still using mercury, saying it's like good, even and it won't cause any harm.
Yes. So the reason for that is, again, is the disconnection that we have in the dental community. I believe that in one of the conferences that I went at the end of last year, they mentioned that most of dental school now, they're not teaching placement of mercury.
Give me a minute. I will mute.
Yeah, can you?
Yeah. Yeah, go ahead.
So I was saying that there's a disconnection that we have in the lack of education. And there's some dentists that they're young, but they stuck in belief. I mean, it takes a long time and a lot of education to deprogram what you have been taught in medical school, dental school, of naturopath school. It's something that you have to come out and educate yourself. And this is where we are. Most of the dentists that are against mercury is because we recognize that it's toxic. So it is allowed by our health department. It is allowed by our government. So until that changes, we're still gonna have people exposed to mercury filling because it's allowed. The insurance is paying for it. The Department of Health thinks okay, so it's legal.
That makes me super angry to see kids still right now getting mercury fillings, even if they are just temporarily in their mouth.
Thank you, Martina, for your comment. It's very sad, and the good thing is that in Rhode Island, a couple of months ago, we have this guy that has advocated for stop mercury in many states. In Rhode Island, being as small as we are, we're hoping that we make a big impact. And Charlie is pushing that some of our politicians here started to lobby with him to make the change. So hopefully we'll create the news for a good reason and say that we are mercury free. So it's a work in progress right now. So hopefully we do get a lot of support and it's go out there and then we stop it.
Yeah. And that's FDA approved too, right?
It is. It is.
Yeah, isn't that wonderful? Anything that's approved by the FDA, I have questions on.
Yeah. So I believe there was a recent report that said that children and that was the ADA, children and immunocompromised people, and there was another group I can remember. I think it was elderly, but three group should not get mercury fillings or should be evaluated before they get mercury filling. But it's okay to put it
Yeah,
in your mouth. Like I did,
it's
you know, it's
amazing.
just we all over the place. We need a reform everywhere.
Absolutely.
So
Mhm. Yeah. Yeah. The next question is, what are your thoughts on using the oil pulling method?
oil pulling, I love oil pulling. We use oil pulling. I use it at home to cook. I use it in my skin to brush, to oil pulling. I personally, and I always say this because I want to be honest, I don't do oil pulling for a long time. And usually they recommend to do oil pulling for 4 to 5 minutes. My cheek gets very tired. So I brush with coconut oil. It have the benefit of being antibacterial, anti-cavity, anti-inflammation. So coconut oil is an amazing way to control bacteria, and it's cheap. It's easy to use. Obviously, it has to be organic, so you get the benefit of no creating or bringing some toxin to your mouth. But oil pulling is great. What happens when you do oil pulling is that you are switching the coconut oil. You creating some movement. Therefore, blood come to the surface. You bring the coconut oil. You also bring in blood and cells to clean. So it's really good. It create a really good clean environment. Obviously, flossing, you have to remove the bacteria. It doesn't replace flossing or brushing, but it's an additive that is very healing. I like it. I suggest it to use often.
My daughter also loves oil pulling.
Yeah,
Yeah.
great.
Yeah. Next question by Diana. She's asking, why is it more advantageous for me to have an extraction in your office versus a non-biological office? How is the procedure different?
Okay, the great question. Thank you, Diana. So we follow a biological surgery protocol. I am lucky to be one of the probably at this point maybe 200 dentists that have been trained in this biological regenerative procedure where we use your blood. We use non-human, non-animal bone for bone preservation. So to make a little bit clear what this is, so when you take the tooth out, if you want to preserve the bone to put an implant later, you need bone there to kind of become your own. So this particular procedure, one of the things that we do, especially if it is any type of infection, is that we clean the area in a way that it was taught in a biological way, which means that we make sure that the area is completely clean, that we use ozone to penetrate in those little holes of the bone. We use laser for the same reason to sterilize the area to create a movement of those bacteria. And then we use your own blood to create that regeneration. So it's a little bit different. No, especially because I was doing a different type of even what I thought it was biological, maybe 2 years ago, 3 years ago, it's not to the standard that I do it now, just because we do better when we know better. And it's a improvement, to provide what is better. So once you know something that works and that is better, it's very difficult to go back and do it the old way. So that's the difference probably that we kind of emphasize more in the cleaning and providing an area that the infection is eradicated.
Yeah. Next question is by Tyrese, and she's asking, I have had an abscessed tooth for 5+ years with no pain or discoloration. I'm scared to get a root canal because it's a front tooth. Plus, it's not holistic. Do you recommend I skip the root canal and get the implant?
She said for 5 years that she has,
Mm-hmm.
yeah. So when an infection becomes chronic, you asking a lot for the body to clean that area. And the reason for that is because when you have an infection, as we show in one of the picture, you take the tooth out, but the tooth is not the problem alone. You actually leaving all the stuff behind. So sequence that extraction in a right way and put in an implant, it would be more beneficial than you trying to get a root canal. I know it's tough whenever we go through this emotionally. For me, I know with the patient, it's tough. Taking a tooth out is not easy, especially when it's in the aesthetic zone, when it's in the front. But you have to wait what is the benefit that I'm going to have in the long term versus taking the chance of having an infection that is never going to heal. So from my point of view, obviously this is something without looking at your x-ray, without doing an evaluation. But based on my experience, you might benefit from extracting and getting that area ready for an implant than keeping the tooth with a root canal.
Okay. And Elizabeth saying, I would just say, I would like to just say hello, and I have been a patient of Dr. Castillo, and thanks.
Oh, thank you. Thank you for being here. Appreciate it.
Yeah. Any other questions? Okay, there is one more question. Why is it important for you to see our blood work before you do an extraction or implant?
Great question. Blood work. So we talked about the importance of preparing the terrain, preparing your body to be in a state of healing. So when you do an extraction, in my office, we use blood work. We want to know what is your vitamin D look like? What is the level? There is a specific level that we do surgery. If it's below that number, we would not touch you. We want to know what the magnesium is like. We want to know what is your sugar. We want to know what do you look like? Because when you do an extraction, you actually asking the body to heal in a certain way, especially when you are putting bone in an area, when you are regenerating the area. You want to create an environment that is perfect, that is a success when you do the surgery. You don't want to take the risk that, oh, it didn't work. Now, what do we do? We have been very lucky that this protocol works beautiful. Usually you call the patient and the patient say, well, no swelling, no pain, they do okay. We do have other people that have a little bit challenging because of other problems, and they take a little bit longer to heal. But the protocol, the blood work is something that we have to have, and it's for that to create a successful surgery and outcome that it's worth going through all the procedure. Good, great question. Thank you.
Any other questions? I think, yeah, there are no questions now. So thank you, Candida, for wonderful information. I learned a lot today, especially like, the mercury and all, because as a homeopath, it's important for me to, if somebody is coming for, side effect. So we have to consider that aspect as well. So thank you so much for sharing all your knowledge and expertise with us.
He's the
Um,
best.
yep,
He
she's the
is the
best.
best.
Yeah.
Thank you.
And
I
thank you,
feel very
everyone.
humble. I feel humble that you all took
Thank you
time
so
tonight.
much.
Oh, you're welcome. Thank you all for taking time to spare a little bit of your night with me. And I hope that this information is useful. Spread the word. There's a lot of toxins there that people don't know. And you don't have to be a biological patient. You could be just ask, what are you putting in my mouth? What are my options? Always ask. We are the best advocate for our health. So thank you, everybody.
Thank
Thank
you.
you, Dr.
Perfect.
Castillo.
Thank
Thank
Good
you,
you.
night.
everyone. Thank you.
Good night.